My name is Sharon Hilses, and I'm going to talk about postpartum depression. Postpartum depression. According to the Canadian Mental Health Association, postpartum depression is what women suffer from after having a baby. When this feeling of continuously feeling down lasts for a long time and is ongoing, it is known as postpartum depression.
Postpartum depression is more common than you might think. It actually affects 15 to 20% of women postpartum. There's a lot of confusion about what is postpartum depression, and sometimes new moms with postpartum depression will question whether or not they have postpartum depression because they're comparing their own symptoms to symptoms they've come across in the media. The more common symptoms of postpartum depression include feeling very sad and tearful, having a really hard time connecting with your new baby, having a hard time sleeping even when the baby's sleeping, often having a lot of anxiety, worried thoughts about your baby, and feelings of guilt, like I'm not a good enough mom. And the symptoms in the more extreme cases are quite rare, like hearing voices, or having thoughts of suicide, or even scary thoughts of hurting your baby. And with postpartum depression, these thoughts are often really unsettling. If you're having any of these thoughts, it's really important to seek treatment, whether it's connecting with a mental health clinician through your obstetrician gynecologist, through your midwife, or your baby's pediatrician. If you feel that you're having symptoms of postpartum depression, you can go online to Postpartum Support International and do a postpartum depression screen, or reach out to a regional coordinator through the website and get connected to a mental health clinician.
Types of postpartum depression. 1. Baby blues. 2. Postpartum depression. And 3. Postpartum psychosis. Cause of postpartum depressions. 1. Hormonal changes. Huge drops of estrogen, progesterone, and thyroid leads to fatigue and depression. 2. Cycles changes. Physical pain from the time of giving birth and difficulty with losing baby weight and having to deal with insecure body image. 3. Stress. No time to sleep. Unsure about your ability to take care of a baby.
Everyone I knew, I felt like had the most wonderful experience after they had their baby, but I didn't know how to say, like, I am freaking out.
Postpartum depression to me is the disconnect you have with your baby.
An overwhelming, uncontrollable sense of anxiety.
One of many mental illnesses that can affect mothers.
When I got pregnant, I was instantly in a bad mood. In addition to that, I had fibroids, which are tumors that grow in your uterus, and it was really scary.
I knew I had postpartum depression from the first time when I went to go and pump my breast milk at work, and I just broke down crying.
I actually remember saying to my husband, people kept saying I'd be so emotional and I feel fine. And the reality of the situation was that I was completely emotionally numb.
Right after I had the baby, it was my husband's birthday, so I baked him a cake and I invited people over, and people were like, "What are you doing?" But I felt like it was my duty to celebrate his birthday, to try to nurse, and then come back and put on a happy face.
I believed that every parent around me knew what they were doing and that I was this devastating failure.
When my son was 4 months old, and I remember breastfeeding him, but he wouldn't stop crying. And I got face to face with him, and I screamed, "Stop crying." That was probably the moment I realized I needed help.
It's a really defeating feeling, knowing that this is something you have no control over.
I thought after that moment, I just need to hold my baby. I don't ever want this to happen again, and something has to change.
being a stay-at-home mom was really isolating, but I felt like I kind of came out of it when I started exercising and hanging out with other moms.
I started feeling better when I could wake up to my baby every morning, and he just makes everything better and everything worthwhile.
To all the mothers going through this, surround yourself with people who get it, because you're not alone.
I know there's so much pressure right now to be like a perfect mom. You have to be honest. You have to let people in and let them know what you're going through.
If you are out there and you are struggling, I want you to know that it is going to get better.
I'm a mother, and I am vulnerable, and I am capable.
And I am fighting every day.
And I'm doing the best that I can.
And struggling with postpartum depression didn't make me weak, but becoming victorious over it, that's what made me strong.
We have lost way too many moms, so please stay with us. Find yourself a community and keep fighting.
Continuing to postpartum depression, someone suffering from postpartum depression will usually show neglect towards their child. About 3% to 20% mothers who give birth will suffer from postpartum depression. It starts from time of birth or 6 months at least for several months or even a year.
The most important thing in treating postpartum depression is to make a careful diagnosis. So we don't want to assume that because a patient called their obstetrician 3 days postpartum and says, I can't sleep, I'm not sure if the baby's getting enough milk, my mother-in-law is visiting and she's driving me crazy. That's not an opportunity necessarily to intervene with medications or to make a diagnosis. So a certain constellation of symptoms need to be present and need to persist for 2 weeks or more in order to make a diagnosis. In an individual with a previous history of depression, we might be quicker to make that diagnosis if the symptoms are pretty pronounced. But in a first episode, we would want to look for 2 weeks of symptoms of depressed mood, hopelessness, helplessness, feelings of guilt, difficulty sleeping, agitation. Typically in new mothers, we see a lot of feelings of incompetence, doubt about their ability to parent the baby adequately or to nurture the baby because they feel they have so little to give themselves. Sometimes when we diagnose depression, we look for what we call vegetative symptoms of depression, problems with sleep, appetite, energy, libido. And if we only look at those symptoms, any new mother is going to look depressed because no new mother has a normal appetite or normal sleep patterns or a normal libido, normal energy. So we really try to look at psychological symptoms primarily.
Signs of postpartum depression. All of baby blues signs, suicidal thoughts, lack of interest and negative feelings toward baby, lack of energy and concern towards oneself, feelings of worthlessness and guilt, change in appetite, sleep more or less than usual. Impact on children. Mothers who show neglect toward baby create an insecure attachment between them and the baby. This insecure attachment will create problems in behavioral, social, emotional, and cognitive development. Someone suffering from postpartum depression will find it hard to take care of their baby. They will show neglect and, in worst cases, bring harm towards the baby. What can we do? Offer emotional support, understanding, patience, and encouragement. Offer hope. Engage into conversations. Never ignore comments about suicide. Remind her that with time everything will get better.